Welcome to Maggie's. I'm Caroline, the co-centre head of Maggie's Edinburgh. Every day in this building, we support people with cancer, their friends and family through the challenges that cancer brings. We're here to offer expert care and support to everyone with cancer and anybody who's been affected by your diagnosis. Our centre is a welcoming space to talk through whatever it is that you're facing. We're located in the grounds of the Western General Hospital, directly behind Ward 1. The idea of this session is to explore and learn more about what to expect from systemic anti-cancer treatment. We'll go through what this can be like, outline the side effects you might experience, and share where you can get support. You'll hear from nurses and doctors from the NHS, the team in Maggie's, and people who've been where you are now.
Getting diagnosed was a shock, and quite quickly I started to realise it was going to change physically who I was, emotionally who I was, what my priorities were. Although you don't necessarily want this to happen to you, we have strength inside us to get through cancer treatment and put up with the difficult days, because actually there's loads of lovely moments to still happen. Cancer treatment's actually brought me and my wife closer than we've ever been before, because we've spent so many times together in waiting rooms and hospital rooms, and we can appreciate that time, because yeah, you don't get it back.
The first thing that I think is a shock. From there on, it's a learning curve. Listen to your body. Don't try and do more than what you feel you can reasonably do. We all make a mistake. We all try to do too much. But if you wake up one day and you feel, oh, I feel good today. I'll do this, I'll do that, I'll do the next thing. And the following day, you're flat. It's managing your energy levels and what your body can do.
Chemotherapy kills cancer cells and stops them growing or spreading in the body. Immunotherapy works by helping the body's own immune system to recognise and destroy cancer cells. Targeted therapies kill or slow the growth of cancers by blocking the unique signals in or around cancer cells that drive them to grow and survive. You may be given these treatments individually or in combination to maximise the effect on the cancer cells. Systemic anti-cancer treatment is often given in blocks of treatment called cycles. These treatments can be administered in a number of ways: by mouth, by injection under the skin, or by injection into the veins. If treatment is given by mouth, then this may be in the form of tablets or capsules. If it has been given into the veins, it will be through a cannula in the hand or forearm, or through a central venous access device, otherwise known as a CVAD. This CVAD could be a PICC line, a skin-tunnelled catheter, often called a Hickman line, or a totally implanted vascular access device, often called a portacath or port. It is likely your treatment will be in Ward 1 or Ward 3 at the Western General Hospital, or in Ward 15 at St John's Hospital.
You will have an assessment before every treatment. For most patients, this will be by telephone. It is important that we have an up-to-date telephone number to be able to reach you, as this helps us to prepare your treatment in advance. You may be asked to attend for an assessment in person. The team will let you know if this is the case. It is often useful to keep a note of any side effects you may experience as they happen, so you can let the nurses know at your assessment.
You will be required to get a blood test before each treatment. The nursing team will advise you when you should book this in. Please make sure you have booked any tests or procedures your medical team have asked you to get done prior to starting your treatment, such as an ECG, dental checkup, or up-to-date vaccinations.
When it comes to getting to and from treatment, we recommend, especially for your first appointment, that someone else drives you. On non-treatment days, you can drive as normal if you feel well enough. On your first appointment, a friend or family member is welcome to attend for the initial consultation with the nurse. and then they will be asked to leave and be given an approximate time to come and collect you. If you are receiving treatment as an inpatient in Ward 3, visitors should only attend during visiting hours. Children should not be brought onto the ward for their own safety. On the day of your treatment, here's what's helpful for you to do in advance. Eat as normal, drink plenty of water, and make sure your hands and arms are warm. This will make your veins more easily accessible. Wear comfortable, loose clothing. Bring something to read, watch, or listen to when you're on the unit to help pass the time. Please bring headphones for any music or videos you would like to bring with you. Buy a thermometer to use at home. If you're unsure how to use this, bring it with you to your first appointment and ask your nurse to show you how it works. When you arrive at the oncology unit, you'll need to check in at the oncology reception and have a seat in the waiting area. At every appointment, the nurses will check how you are in case anything has changed. The length of your appointment time will depend on the type of treatment that you are receiving. Before you start, there will be time to discuss your treatment with your nurse. They will answer any questions you may have and check that you are happy to proceed. They will ask about your current medication, so please bring a note of the tablets you currently take with you. Please bring any medication you may need to take during your visit, or all medication if you're staying overnight.
If you're having therapy into the veins, we will assess the veins in your hands and forearms and discuss any concerns you may have. If receiving your treatment through a cannula in your vein, problems can occasionally occur if the drug leaks into the tissue around the insertion site. It can cause the surrounding area to become sore and inflamed. This may be tissue damage, called an extravasation.
Extravasation causing tissue damage is a rare occurrence, and our nurses are fully trained to help prevent this. However, there are several things you can do to help us reduce this risk. Firstly, position anything you might need during your therapy, like drinks or a book, next to your free hand before your treatment starts. Secondly, wear short sleeves or ones that can be rolled up easily. Sometimes it can take more than one attempt to get a cannula into the vein. If your nurse is at all concerned about a cannula, they will start again in another area. Although this can be frustrating, it is done for your safety. Keep the skin around the cannula visible. It is very important to let us know if the cannula or CVAD site does not look or feel right at any point during or after your treatment. If your cannula or CVAD site does become sore, red or inflamed any time after treatment, it is important to call the Cancer Treatment Helpline number straight away, as this could be an extravasation. There is also a possibility that you may experience an allergic reaction to your treatment. This is known as a hypersensitivity reaction. The staff will advise you what to look for and will monitor you closely. Nurses are trained to manage these reactions should they occur. We ask that you do not leave the ward while receiving your treatment for your own safety and for the safety of others.
After your treatment, you might start to notice physical side effects and emotional challenges too. In this section, we'd like to talk you through what those might be. These do not apply to everyone, and you may receive treatment without noticing them. However, it is still important to be aware of them and how to manage symptoms if they occur. Some drugs, specific to certain treatment regimens, can also cause side effects. The list of potential side effects can be concerning, but for the most part, they aren't dangerous and they can be managed, especially if identified early. In all cases, if you're worried about your side effects, call the Cancer Treatment Helpline. This is a 24-hour, 7-day-a-week service, which is there to give you advice when you need it. There may be an occasion when the line is busy. please leave a message with your name and number and someone will phone you back. When you contact the Cancer Treatment Helpline, they will provide advice and, if necessary, organise for you to have a medical review. If you're asked to come in for an assessment, please bring an overnight bag, in case you're required to stay. So let's look at some of the possible side effects of systemic anti-cancer treatment. You might feel breathless and more tired. Treatment can interfere with the production of red blood cells, which carry oxygen around the body. This can occasionally result in anemia. In some cases, you may be offered a blood or iron transfusion. Treatment can also interfere with the production of platelets. These are responsible for blood clotting. If these are low, you may notice that you bruise or bleed more easily. Your treatment may also interfere with the production of white blood cells. This reduces your body's ability to respond to minor illnesses or infection. You may feel shivery or have a temperature. If your temperature is above 37.5 or below 36 degrees Celsius, or you feel unwell, you must call the 24-hour helpline. Please be aware you can have a normal temperature and still have an infection. So if you do feel unwell, you should contact the Cancer Treatment Helpline, even if your temperature is normal. The best things you can do to avoid an infection are: keep clean. Always wash your hands after using the toilet and preparing food. Clean your teeth at least twice a day and regularly drink water. Make sure the food you're eating has been safely prepared. Clean your hands thoroughly while at the hospital. Wear protective gloves when doing things like gardening or cleaning up after your pets. Stay away from people who you know have an infection, such as the cold, flu, measles, or chickenpox. If you come into contact with someone who has had chickenpox or measles, please contact the Cancer Treatment Helpline. You may experience diarrhea, which can lead to dehydration if untreated. This may also be a sign of infection. Equally, you may find that you're constipated. You may feel sick or vomit. Make sure you're taking the prescribed anti-sickness medicines as advised. To help, try sipping small amounts of liquids as often as you can manage them. Eat little and often. Don't get hungry. Try ginger biscuits, or any food containing ginger. Fatigue is a common side effect. You may find some days you feel lethargic and easily worn out by activities. Have a good bedtime routine. Some gentle exercise like a walk in the fresh air is often helpful. You might find that you need a nap during the day. If you are receiving chemotherapy, you may experience partial or total hair loss depending on the drugs you receive. This is usually temporary, and there are resources to help in caring for your appearance. You may have heard of a cold cap or scalp cooling to help prevent hair loss. If the treatment you are on is suitable for this, your nurse will discuss whether this is right for you. You may experience soreness in your mouth or gums, or find you develop mouth ulcers. To help, use a soft toothbrush after eating to clean your teeth. Rinse your mouth after meals with sodium bicarbonate solution and keep your mouth and lips clean and moist. Avoid alcohol-based mouthwashes or chlorhexidine. Stay hydrated and try to eat soft foods. You may experience dry, flaking skin on your body, hands or feet. This can be helped by applying an unperfumed moisturizer. Protect yourself against the sun and use Factor 50 sunblock, and cover your scalp. You may experience a tingling sensation or abnormal sense of touch or prickling like pins and needles. Please report this to your team or nurse at your next visit. You may also be at higher risk of developing blood clots in your legs, known as DVT, or lungs, known as PE. You can help prevent a clot by taking regular short walks to keep the blood moving, or doing simple leg exercises such as bending and straightening your toes. Most clots can be successfully treated using drugs to thin the blood. You may find that the main side effect you'll be feeling isn't physical, but is psychological. Systemic anti-cancer treatment affects the body, but it also has an impact on the mind. It is completely normal to experience heightened feelings of stress, anxiety, or worry during systemic anti-cancer treatment. This is shared by many people. You are not alone in feeling this way. Some side effects are more specific to immunotherapy, so let's take a look at these in more detail. The effects can occur soon after treatment starts or many months after finishing. Sometimes immunotherapy can cause inflammation of joints and muscles, resulting in pain and swelling. If this is mild, it could be managed with pain relief, such as paracetamol. You may experience a change in breathlessness or develop a cough. Fatigue is a common side effect of immunotherapy treatment. Eating well, resting, and gentle exercise as you are able are good techniques to manage this. You may experience diarrhea or more frequent bowel movements if the lining of the bowel gets inflamed. Immunotherapy can affect your endocrine system, causing changes in the hormones your body produces, which can make you feel tired, irritable, or dizzy. We will monitor this with regular blood tests. You can develop itchy skin or rashes. We can supply unperfumed moisturizing creams to make rashes less uncomfortable. If you feel particularly unwell at any point, if there is anything out of the ordinary, or if you're concerned by the changes taking place to your body, please contact the Cancer Treatment Helpline. Help and advice. What to do if you become unwell after receiving any type of systemic anti-cancer treatment. You should seek advice from the Cancer Treatment Helpline if you feel shivery or unwell at any stage in your treatment. If your temperature is above 37.5 or below 36 degrees Celsius, or you feel unwell. If your bowels are moving an extra 4 times in a day than what is normal for you, or your stoma output is much greater than normal. If you have not had a bowel movement for more than 2 or 3 days. If you experience severe abdominal pain or bowel movements that are black or contain blood or mucus. If you are being sick more than once a day or are unable to keep fluids and anti-sickness medication down. If you're suddenly much more tired than what's normal for you and are unable to manage basic daily activities around your home. If you have a painful mouth, gums, or lips and are finding it difficult to eat or drink. Or if you have visible blisters on your lips. If you develop more serious skin changes, blisters, bleeding, or puffy appearance, if your skin is painful, or if you have a rash covering most of your body. If you experience moderate to severe pain in joints and muscles. If you experience new breathing problems or an increase in breathlessness or develop a new or worsening cough. If you're unable to complete your daily activities such as washing, dressing, and moving around your home. If your cannula or CVAD site becomes sore, red, or inflamed any time after your treatment.
However, there is one exception. If you develop chest pains, difficulty breathing, or require urgent medical attention, this is an emergency, and you must call 999 or attend A&E and ensure that they know you are having systemic anti-cancer treatment.
You can have sex whilst receiving systemic anti-cancer treatments, but you will need to make sure you take precautions.
All patients who are on treatment regardless of age should use a barrier contraceptive like condoms for up to 7 days following administration of a drug. The drugs can be excreted in bodily fluids, and it is therefore important to protect your partner from accidental exposure to these.
It is essential that contraception is used throughout treatment if there is any chance of pregnancy, as these drug treatments can have harmful effects on unborn babies. It is not wise to carry on smoking. It is possible that some drugs do not work as well in people who smoke. Also, the risk of developing a second cancer if you continue to smoke while on treatment is higher. Smoking is not permitted anywhere on the hospital site. Therefore, once your treatment has started, you will be unable to leave the building to smoke.
You may continue to drink alcohol in moderation, but it is best avoided for the 40 hours after treatment. Both alcohol and anti-cancer drugs are broken down in your liver, and this means that your liver must work much harder. Certain medicines can react badly with alcohol, and if your treatment includes these, we will let you know before starting.
Medicines that contain paracetamol can hide a temperature, which could make it more difficult to spot an infection when you're on treatment. Paracetamol can be taken for pain relief if you are otherwise well with no other symptoms. If paracetamol is a part of your regular pain control, please continue to take it. Systemic anti-cancer therapy passes out of your body in your urine, bowel movements, and other bodily fluids. Coming into contact with these bodily fluids can be harmful to those around you. We recommend you buy a pair of strong household gloves to use for cleaning jobs. Wash them with detergent and hot water before drying and storing them for this use only. Your laundry can be done as normal. However, if this is soiled with urine, diarrhea, or sick, we advise you to wash these items at a high temperature and separately with another cycle of the washing machine run on empty afterwards. We recommend that you sit down on the toilet to pass urine, close the lid of the toilet when you flush it to avoid splashes, and flush the toilet twice. Any waste that cannot be put down the toilet should be put in one disposable plastic bag, then another, tied securely and disposed of in household rubbish.
It is important during treatment to eat if you can, but try not to get upset if there are days when it is a struggle. Try to keep drinking plenty of fluids to flush the drugs through your kidneys. If possible, try and eat a healthy, balanced diet made up of foods that you enjoy. You may find that your taste will change when you are on treatment, and you may go off some of the foods you normally like.
You can be more prone to getting an infection following treatment. To help prevent this, the advice we would offer around food is to avoid unpasteurised milk, raw meat, raw fish, raw shellfish, raw or undercooked eggs, all soft cheeses made with unpasteurised milk like feta, all mould-ripened cheeses like brie or camembert, and blue-vein cheeses like Danish blue or Stilton, probiotic drinks, yogurts and live cultures, pâté and fish paste.
I think the first thing that I would say is that everybody's body is different. So while you get the list of side effects that can sound particularly daunting, you might not get any of them, you might not get all of them. Don't suffer in silence. What I would do is I would phone the cancer treatment helpline. You need to speak up, and no problem that you're having is too small. So I was particularly anxious on the first day of my chemotherapy treatment, which is fear of the unknown. You don't know what you're going into. But immediately the nurses in Ward 1 were able to talk you through exactly the process, calm you down. You're very well looked after. They're very professional, but very friendly at the same time. You know, they take time to speak to you as a human being.
Since treatment, fatigue and brain fog have impacted me, and I have suffered from that in the few months following when I was recovering from treatment. Speaking to people, I've come into Maggie's, I've gone to a young women's group, I've been to a Aware Now group, and all these courses have really helped because there's other people in the room that have gone through the same symptoms and side effects. Or even just taking time out, like just understanding that my brain is overloaded just now and I need to calm things down and take a break, and that's really been helpful, especially having a young family to deal with. That's a full-time job in itself.
So before my treatment, I had long red dyed hair. The advice was to get my hair cut shorter. Actually, I quite liked it, if truth be told. So what I chose was to wear turbans, and got lots of comments about how great I looked in the turban. Kind of miss it now.
One of the things that we did was we had a conversation with the kids about what I was going through. We talked in younger language, we talked about bad cells that weren't working and things like that, but we did use the word cancer so that they would know that this was something that we were going to hear about, but that I was in treatment and I was going to get well again. So trying not to have them worry too much, but be in the picture so they knew what was going on.
The help and support I've had from my wife. She is a very positive person, and right from the start she was able to get that through to me, just to try and stay positive for as much as you can. It's not possible all the time, but that was the help that I most appreciated. A shout out for the Maggie Centre. The information you can get from them, they're always here if you have anything you want to know. For me personally, I got benefit advice, blue badge advice. Never occurred to me that I might be eligible for a benefit, which I was.
It probably wasn't until about 6 months after all my treatment had finished, I felt then that's when it hit me, emotionally. But good old Maggie's, back to Maggie's, and did stress courses, relaxation classes, and it calmed me down.
We hope that this has helped to prepare you for your treatment. If you do have further questions, do not hesitate to ask. We offer a range of emotional, financial and practical support here at Maggie's. There may be another Maggie's Centre closer to where you live if you are out with Edinburgh. We are open Monday to Friday 9 till 5. No appointment is necessary. Please pop in or phone anytime.